Hello, my name's Dr. Paul Richardson, and I'm the Director of Clinical Research at the Jerome Lipper Multiple Myeloma Center at Dana-farber Cancer Institute in Boston, and I also serve as the clinical program leader there, as well as the R.J. Corman Professor of Medicine at Harvard Medical School. And then the final abstract that we presented was an update on an exciting new monoclonal antibody, isatuximab, or SARCLISA as it's known, and we were showing long-term follow-up from our ICARIA trial, which led to the FDA approval of isatuximab, or SARCLISA, combined with pomalidomide and dexamethasone. And what we showed in this study was that with long-term follow-up, not only was the progression-free survival benefit maintained, encouragingly no new safety signals were seen, and again, what's so important as well is that with the long-term follow-up, there was a very important and strong trend to survival benefit in favor of the three drugs over the two. Now, it didn't quite achieve statistical significance. It was 0.03 by what's called a p-value versus 0.02, which was the requirement. But nonetheless, the actual gain in median overall survival was clinically very meaningful. So it was nice to be able to share this with the group. And what we were also able to show that rather than keeping the monoclonal antibody in reserve and using it later, it made probably much more sense to use all three drugs first in the setting of any particular relapse. And that's obviously very important information to share with the community in that regard. So I just want to close by thanking you very much for your attention, and I hope the discussion that we've just had is helpful. And above all, it's been an absolute pleasure to be here at the IMS at a really exciting and very dynamic meeting with lots of new discoveries and advances reported. Thank you.